So hello everyone, welcome again to this session on the embryology and the histology part, LMRP. LMRP is our last minute revision points. My name is Dr. Ankit Khandelwal and I'm your anatomy educator. I have an MBBS and MS in anatomy, and this is a YouTube session, and this session we're discussing histology and the embryology important MCQs. Let us proceed and see. Now, as we proceed further, what we see are the few benefits of the subscriptions. So here you are seeing the few benefits of the plus subscription if you avail. You have the daily live classes, you have the structured courses, you have the unlimited access, you have the live test and quizzes. These are the benefits of the plus subscription. Okay, now as we move forward, we also see the iconic subscription. Iconic is when Unacademy and Prep Ladder both they combine hands, this becomes iconic. You have the live classes, you have the recorded sessions. That is known as iconic subscription. As we move ahead, we see there is a limited time period offer. For that iconic subscription, the prices are slashed right now, and you can avail all these various time periods and for mainly this iconic Unacademy plus Prep Ladder. So have a look at it from 12 months, 18 months, 24 and 36 months. You have all these criteria. Okay, just a second guys. Now, here are other points. Let me show you. These are all the benefits of the plus subscription, the batches. Today is 15th of June. From tomorrow, we are going to start this NEET PG seasons batch. We are going to start the NEET PG seasons batch from tomorrow, 16th of June. The various points, salient features are written over here. You can have a look at it. Then there is also, from tomorrow, there is also a batch going on for the next exam. The target is next 2022. Okay, that is from tomorrow. Now, as we move forward, we also see that Unacademy has also tried to enter into the professional year courses, because there was a huge lacunae, because most of the colleges we know that how the studies and how much students are serious or whatever factor is there. So there's all these live classes for the prof. So from first prof, second, third to final prof, all the batches which are starting from tomorrow, when within a week all the batches are going to start. Okay. Now other benefits guys, that this is a very important benefit. If you subscribe for at least 3 months, you get an extra 1 month. You subscribe for a year, you get an extra 2 months. Remember that. These are the important points. Okay. Now, if you go into the whole app or the website over there, you will see the various options either for the plus, that is only Unacademy, and for the iconic, that is Unacademy plus Prep Ladder. You get all these different time periods in which you can avail all these various packages. As told you, in 3 months right now, you are getting 1 month extra. For 12 months, you are getting 2 months extra. And on addition to it, you can apply this code Dr. Ankit Live. So remember the code over here, as I'm live over here. So that is Dr. Ankit Live. If you apply this, you get some extra discount. Okay, so that was the whole part. Now let us move to a topic and let us come to a topic. Topic was what? Embryology and histology. We'll start with some histology, MCQs, histology, and then we'll move obviously to the embryology part. These will be some of the clinical MCQs. Okay, clinical MCQs. Histology will be only for recognition of which slide. Come to the more clinical aspect for the embryology part. So, fair enough, let's start over here. So, let's move to this first MCQ. Let us start the histology and the histology slides, and here you go. Identify guys, identify over here. I'll move aside, or this side I guess would be fine. Identify the histological feature. So, you are seeing over here that the arrow is pointed out towards something. What is that thing that you have to identify? 4 options are written over here. From villus to gut-associated lymphoid tissue to the lamina propria to central vein. You can answer in the comment box guys. What is this arrowed structure? Is it a villus? Is it a gut-associated lymphoid tissue? Is it a lamina propria? Is it a central? I don't think it is a very difficult question. It's still, just for the start. Yeah, hello everyone, welcome. Welcome Khairul and others, Rahul and others. Rajaram started with the answering, and so has Satyapriya started. Charu, very good, very good, very good. I don't think it is very tough. You shouldn't be too much. See, sometimes overthinking is dangerous. Keep it simple. The arrow is pointing towards this projection, which is a finger-like projection. That is undoubtedly our villus. Keep it simple. Why do simply complicate it? To start with simple. These are the villus. Villus are found where? Villus are finger-like projections basically to increase the surface area. They are found where? Mainly in the small intestine. They are found where? Mainly in the small intestine. Remember that part. Okay, mainly in the small intestine is where you find them. Could be from anywhere from the duodenum, jejunum, ileum. So villus are there. Their size and their shape changes, but villus are there. To increase the surface area. Why? Because we all know absorption, gut, simple. Okay, let us move to the next one. So this was a villus over here. Let us see the next slide. Identify the histological feature. What is shown on this slide? Options are trachea, colon, GB, gallbladder, and esophagus. These are the 4 options. Identify, guys. Try to see. Somewhat related to the previous slide, I hope. Yeah, welcome everyone. Now, Villa is over. Next question, guys. Next question. Here we are getting the answers as options B and D and okay. What is the feature over here? It's a part of gut only, and it's actually a colon. But how? What is the feature of colon? Colon is a part of large intestine. Understand? Histology is not about seeing the slides again and again and again and again and again and again. To be very frank, you see slides for 10, 20, 30 times and again you forget it. The reason, what is the reason? Reason is you look for a slide, you try to understand, okay, this slide is say of, I'm saying colon. Your mind should ask why. Okay, sir, there are goblet cells and all that, but sir, why? Function. What is histology? It is microscopic anatomy. Gross anatomy is what you look from the naked eyes. Microscopic anatomy is what you look from the microscope. So this is the function. What is the function of colon? Large intestine. Absorption has been happened. Now the substance is passing through the large intestine. What will happen? First you will have the water is getting absorbed. Now stools are getting formed. And as the stools are getting formed, you need a passage which is very, very slimy and very smooth. So more of the goblet cells for the mucus secretion, more of the goblet cells. Here you can see all these are goblet cells. All these are goblet cells lined by. Feature of colon, specific feature of colon. There are other features also, but looking at this slide, it is undoubtedly a colon over here. For those going with esophagus, esophagus doesn't look like this. What is the epithelium of esophagus? First of all, understand what is the epithelium of esophagus. That is a stratified squamous epithelium. That is different. This is a columnar epithelium for the intestine. I hope the point is clear. Let us see. Now look over here. Look over here. What is being shown? This is again the large intestine, but complete. Complete means, let me show you. This is the epithelium part that is columnar with goblet cells, right? And what else? What else is over there? You can see that this epithelium. Then there could be some lamina propria. This could be the mucosa. Then the submucosa. What is submucosa? The glands and the connective tissue. And what beneath this? You can see the muscles. What are the muscles? ICOL. Always remember IC. What is ICOL? Inner circular outer longitudinal. In the colon, remember the word tinea coli. So you will have the longitudinal muscles are arranged in bundles. So this sort of slide is given. Look for the muscles. That is a hint. Tinea coli. See, gross looking from the. So understand the function first. Then look for the basic feature. This is what was shown over there. And we show you this is the whole epithelium. That is a small muscle known as muscularis mucosae. This is known as a muscularis externa. That is muscularis mucosae. It's a part of mucosa. Muscularis mucosae is a part of mucosa. All these things. Okay, let us move to another one. I hope the point is somewhat clear. Identify, guys. I don't think it should be difficult, but still, let me give you the options over here. What are the options? The options are ciliary body, lens, cornea, iris. I guess the options are very easy. Yes or no? Ciliary body, lens, cornea, iris. Identify. This is the pathognomic feature, characteristic feature, and I'm waiting for your responses, guys. Rajaram, the first to respond. Very good. This is the epithelium over here. Here, this is outside. That is the epithelium. Epithelium is a stratified squamous, obviously non-keratinized. This whole is your substantia propria over here. Regular arrangement of fibers. Then obviously you have the Bowman's membrane and you have the Decimate's membrane with the endothelium on all the parts of the cornea which you see. This is definitely, undoubtedly a cornea. Let us see an actual slide of cornea. Epithelium. Epithelium, EP is for the epithelium. Non-keratinized. Obviously, your light has to pass through it. Then obviously the Bowman's membrane, that is your whole SP substantia propria, uniform arrangement. Then you have this DM is obviously, it's not a district magistrate, that is the Decimate's membrane. And here EN is for the endothelium. There's one more layer known as, I guess, Dua's layer. Some Indian scientists are also, one more layer has been added in respect to the Indian scientist, Dua's layer. I guess the Ophtha people will tell you better for that part. But there's a layer, Dua's layer. Okay. This slide, again, look at the question, the slide. Identifying feature, guys. Why? Function. Light has to enter. Why? Regular arrangement. You don't need lights to get bend anywhere. Light has to enter straight down like this. Function. Stratified squamous. Why? Facing outside. Like my cornea is facing outside. Your cornea is facing outside. You need some protection or not? Non-keratinized. Why? Light has to pass. Right? Answer this, guys. Identify the arrowed histology. Arrowed means this part. Identify this. This whole area, identify. Is it a capillary, arterial, tunica adventitia, or tunica media? Identify. Yeah. What is this whole area over here from here to here? This is the whole area. They are asking you. Is it a capillary, arterial, tunica adventitia, or tunica media? Yes, Ankit, you are right. This is a connective tissue layer. C and D. C and D is what you guys are coming up with. The slide is of what? Slide is of vessel. Slide is obviously of a vessel. The vessel. Three features, remember: tunica, TUN. From inside you have a tunica intima, then you have a tunica media, and you have tunica adventitia. As simple as that. Adventitia is the outer supporting layer. Outer supporting layer. It is more thick in veins. Tunica media, medium muscle. The muscles and the elastic fibers. That is more in case of artery. More means more thicker, because you have seen the gross. I'm just telling you how to understand the gross from the or how to understand gross from the histological. Same thing. And intima is the innermost layer, basically the endothelium layer. Now look at this slide. Look at this slide. Intima is normally the endothelium. This is the INT dot intima. This is whole media. This whole connective tissue is what? That is your answer. This is the adventitia they are asking you. Now there are various subtypes, which is the muscular artery, which is the elastic artery. Understand one thing. In the tunica media, if you have more of elastic fibers, it is an elastic artery, common sense. And if you have less of elastic fibers and more of just smooth muscles, obviously that is a muscular artery. Elastic arteries are the bigger arteries, the aortas and their main branches. Muscular arteries are second division arteries, like radial artery, brachial artery. These are the muscular arteries. What is it? Why, sir? Simple. Look at the heart. It is pumping in this manner. 120/80. All the blood is directly going to the aorta. It needs elasticity. It needs elasticity. It has to undergo that pressure so many times in a minute. That is why elastic artery examples are different. Okay, let me show you the same image, guys. This same image that you can see the intima over here. This whole is the media with elastic fibers. That is actually the elastic artery. And this is the adventitia with the connective tissue. And there you can see some vasa vasorum and other stuff. Just a labeled picture over here to show you the basic idea of a vessel. Okay. Now let us move ahead. Identify, guys. But sir, what? Identify the histological feature. But which histological feature? This histological feature. Okay, identify. Is it an outer nuclear layer? Let me give you a hint over here, though it is not needed, I know. It is a slide of retina. Okay, fine. 30% job done. Is it an outer nuclear layer of rods and cones, plexiform, or the ganglion cell layer? Look at it and identify. Look at it and identify. Look at it and identify. Outer nuclear layer of rods and cones, inner plexiform, ganglion cell layer. Answer. B and C is what you guys are going with. What is B? Rods and cones. What is C? Inner plexiform. Okay. Any other one? Again, this whole pendulum is going towards B and C. B is like a seesaw. B and C only. But one, you have to choose only one. No. First of all, let us understand, then come to the answer. Retina, we all know, has approximately around how many layers? 10 layers. But look from this slide and first of all identify it as retina. But how? I have told you, but how? If you are still confused, look at these dots over here and here. If you get these two sort of dots over here, these are all the nuclei. It is probably a retina. Plus look at this hole. Tell me this side is the choroid one. Why? It is pigment. The choriocapillary layers are over here. And this side is the vitreous side. So the light is entering from here, then it gets absorbed over here. So it can get absorbed. It shouldn't be reflecting here and there, else we all will go mad. We look at any picture and it goes here and there, then we all will go mad. Right or not? So there is a pigment cell layer. Pigment cell layer. So obviously this has to be, first layer should be the pigment cell layer. Then comes the other layer. Let me show you in the figure actually. You'll understand better in this. I look at this. Just want to understand that retina as a what? Histological picture. So choroid is written over here. That is lower down. It's choroid. It's a choroid, right? You can see all the pigments and the choriocapillary layer. Choroid, remember, it's a vascular part. ICC, remember ICC? I used to remember it like this in my UG days. Iris, ciliary body, choroid is a vascular part. Remember Parsons in ophthalmology? You used to read that also. Fine. So choroid is this. Then you have the pigment cells. Pigment cells over here, layer number 1. Can you see this pigment cell? These are the pigment cells written over here, and these are shown over here. Then you have the photoreceptor layer in the question. That is the answer. That is a layer of rods and cones, layer number 2. Okay, that is your layer number 2. This was actually shown in the question. Let us look at the question again. This is your layer of rods and cones. The cones are obviously triangular in shape. Rods will be like this. Okay, these are rods and cones. So that is layer number 2. Then there is a very small outer limiting membrane, OLM. Okay, right over here, pigment, R and C. It is not R and D, it is R and C. Second, third. Then you have the cell bodies. You have the cell bodies. These are the cell bodies. CB of rods and cones. Layer number 4. Layer number 5 is the outer plexiform. Dendrites and axons. This is the outer nuclear layer. But nuclear of what? Nuclear of mainly the bipolar. Other cells are also there, but bipolar are there. Then you have the inner plexiform. This was the outer plexiform. This is the inner plexiform. Numbers you will see. Inner plexiform, layer number 7. Layer number 7. Then you have the ganglion cells. This is the inner nuclear. Not inner nuclear, but the ganglion cell layer. Okay, so this is the ganglion cell layer. Inner nuclear was where? Outer nuclear. Oh, this one. Inner outer, yes, cell bodies. This one is your outer nuclear. We had a little confusion, and this IN is actually inner nuclear. So bipolar is the inner nuclear. So we'll repeat it again, don't worry. This is a ganglion cell whose axons they form the optic nerve, and then you have the optic nerve fibers, and this is the inner limiting membrane. Just wait a second over here. We review it again so that should be perfect. First of all, understand the light will come and strike over here to end over here in the pigment cell. Rods and cones get excited. These are the cell bodies. The cell bodies of rods and cones are outer nuclear. The cell body of rods and cones are an outer nuclear layer. Fine. Then their axons and their dendrites, outer plexiform. Next layer comes the inner nuclear, that is mainly a bipolar. So outer nuclear, inner nuclear, right? Then their axons, their dendrites. Whose dendrites? A ganglion cell. And then their axons form the optic nerve, and the 10th layer is inner limiting membrane. Let us layer number wise. Layer number 1 is the pigment cell. Layer number 2, rods and cones. Layer number 3, outer limiting. Layer number 4, outer nuclear. Then outer plexiform. Then inner nuclear, inner plexiform. Simple. Then ganglion. Then their axons, the optic nerve. Then you have the inner limiting membrane. If you combine them, you reach from 1 to 10. Okay, just practice it once or more. This is how they are synapsing layer. This are the, what we call as the neuron 1, neuron 2, neuron 3, all those parts. So neuron 1, neuron 2, neuron 3. This is neuron 1, rods and cones, neuron 2, and neuron 3 over here, neuron 3 over here. And neuron 4 will be in the lateral geniculate body. In the lateral geniculate body of the thalamus. Okay, so here in the slide, they ask you about this. So this is your outer nuclear. That is the inner nuclear, outer plexiform, inner plexiform. That is the ganglion cell layer. I hope it is somewhat better. Okay, let us see one more over here. Try answering this. Histological feature. Which slide is this? Look at the slide. Is it appendix? Is it testes, esophagus, or colon? I hope you already seen the colon. You have appendix, testes, and esophagus, and colon, 4 options. Try answering this. Appendix, yes or no? Star-shaped lumen, answer is no. Testes, you will have seminiferous tubules, answer is no. Colon, we already have seen columnar, and the goblet cells, answer is no. It is esophagus. So rule out also. Why esophagus? Look at the epithelium. What is the epithelium of esophagus? Stratified squamous, obviously non-keratinized. And then you have the esophageal glands in the mucosa, submucosal layer. Esophageal glands. All the layers are there. You have the muscle layer, musculus externa. You have the muscle layer inside also. This is a slide of esophagus out of all these 4 options. Let us see. Okay, See the next one. Fine. Identify this, guys. This slide. Look carefully. Kidney, liver, thymus, or spleen? Answer. This is important. Kidney, liver, thymus, or spleen? Out of these four, which one is this? Out of these four, which one is this? Kidney, liver, thymus, and spleen. Waiting for your answer. Okay. Most of going with C, and then A and B. I hope you are seeing the options, right? What is C? C is thymus. Okay. Fine. Okay. C. Paras going with D. Okay. Why C? We see what? C is thymus. What is the feature of thymus? What is the feature of thymus? Thymus is a primary lymphoid organ. Reticular fibers. Then the lymphatics are distributed in lobules, not nodules. Thymus, you have the cortex and medulla, and you have the Hessel's corpuscle. You have the Hessel's corpuscle in the thymus, right? What is the feature of a spleen? R and W, red and white pulp. That is the feature of spleen. Majority of the spleen is red pulp. Some part of the spleen is white pulp. Which is white? Which are having the lymphatic nodules. These are the white pulp. What is red? Which are having the venous sinusoids or venous sinuses or sinusoids. That is a red pulp. Spleen, this, guys, is the slide of, not very good a slide, but yeah, that is a slide of a spleen. You can see few things over here, like what? Like you can see the trabeculae over here. Majority of the things which you are seeing over here, they are actually, most of them are red pulp. Most of them are red pulp. Here some white pulp you will see. Not very clear. I will show you another image also. In this white pulp, you get a very small, like you can see over here. Let me show you some other also. These are your eccentric arterioles known as central artery. Okay, in the white pulp. Let me show you another image, I guess. That would be better. Look at the slide of a spleen. This from the atlas, but look at the slide. Most of this picture, this is the whole, that is the whole red pulp. These are all the venous sinuses. This is whole red pulp. 80 to 90% of the slide of a spleen is red pulp. Why? Because understand the functional anatomy also over here. The spleen has mainly two functions. What are these two functions? One, you have to do the sequestration of the old RBCs, yes or no? So for that, the RBCs should be passing through all these sinusoids, between the sinusoids, so that the old RBCs are destroyed there. They are caught up. That is function number one, mainly done where in the RP, red pulp, mainly done. Second function, it is a lymphoid, so obviously you have to have some lymphatic tissue, that is antibody generation production, fighting pathogens, all that. So that is mainly done in the white pulp. There are the lymphatic nodules over there, lymphocytes are over there. So these are two functions. So white pulp is this part, that whole is white pulp, it's having the lymphatic nodules. Sorry, not this, yeah, but this one. This is having the eccentric. Now that is a handmade picture, so it is obviously looking very good. These are all the eccentric arteries known as central artery. Known as central arterioles or central artery. Okay, written over here, central artery. And this is your whole white pulp with a germinal center, pale germinal center in between. But majority is a red pulp. Look at that previous image once again. The majority of the things you see are basically all red pulp. 80-90% of the spleen is red pulp. Okay? Try to understand. In thymus, you will see as lobules different. And those medulla will have, the cortex medulla will have the small Hessel's corpuscles, the epithelioid cells over there. Okay. One more over there. We have to do some embryology also. Okay. No problem. Look at this arrowed structure and try to identify what is this. What is this? This arrowed structure over there. Islet of Langerhans, Brunner's gland, crypts of Laocoon, or muscularis externa. There's also been magnified for you. Try to understand. Look from the epithelium. You will take hints from there. You will take hints from there and then answer. Then answer. Think. Should be standing here only so that you can see at least. B and C. What is B and C? Brunner's and crypts of Laocoon. I hope you got the point that what you have to answer. You have to answer which area is this actually. So looking at the epithelium, it's look like a gut intestine with a villi. This is your mucosa. That is your submucosa, that is SM. And the glands in the SM, you know that. We are dealing with the duodenal glands. Glands of duodenum, the Brunner's gland. The Brunner's gland. Have a look at this picture and try to correlate now. This is the same that is your duodenum slide. You can see the villi over here, the projection in the surface area. and you have a small muscularis mucosae over here. Small layer of muscle, smooth muscle in the mucosal layer. Then you have this as a whole submucosal filled with the Brunner's gland. The Brunner's gland is there in the whole duodenum. What is the function of Brunner's gland? To counteract the effect of acid product which is coming from the pylorus part of the stomach. So tell me, if I ask you which part of duodenum will have more of Brunner's gland, the first part or the third part? Two options are there. Which part of the duodenum will have more of Brunner's gland? The first part duodenum or the third part duodenum? More of Brunner's gland. Where will be more amount of that? More of Brunner's gland will be found where? Obviously in the, because acid product is coming directly into the first part of duodenum from the stomach. So more Brunner's gland will be over there. Okay, yes, very good. It is the first part. Okay, let us see one more. Okay, again, identify the arrow histological feature. Brunner's again, then you have the muscularis mucosae, muscularis externa or secretory epithelium. Arrow, look at the arrow. Let me move this over there so that you don't get confused. Look at this arrow. Okay, I hope you can see it. Put one more arrow over here. Okay, what is that? A, B, C, D, 4 options. Brunner's gland, 2 muscularis and a secretory epithelium. Kaushik, Rajaram going with B, Bijesh going with C, B. What is B over there? Muscularis mucosae. Most of you are going with this option. Let us see this option. Yeah, definitely it is muscularis mucosae. Why? Because this is the whole epithelium. See, one basic thing. Slide of the GIT will have the mucosa, submucosa, muscle layer and the serosa or adventitia. Mucosa has 3 components: epithelium, lamina propria, muscularis mucosae. Very small muscle, only for slight movements of that particular mucosa. Submucosa is basically the connective tissue. It is quite tough. That is a muscularis externa, ICOL, inner circular outer longitudinal fiber. I'm going a little bit fast. This is revision. Serosa adventitia, if it is a intraperitoneal organ, go with serosa. If not, go with adventitia. Simple as that. Simple, they are outer connective tissues. This whole is the mucosa, and you're seeing the muscularis mucosa over here. That is the submucosa, and this is your muscularis externa. Therefore, the answer. Okay, identify this. Yeah, fungiform papillae, colon, circumvallate papillae, or the plica circularis. What is this? What is this slide over here? Identify. Take your time. A, B, C, D. Yeah. Are you getting the options? C. Yes, C for circumvallate papillae. This is circumvallate papillae which is present in the anterior 2/3 of the tongue in the gross anatomy, and its nerve supply is surprisingly by the 9th cranial nerve. That is another question. Around 10 to 12, maybe 14 circumvallate papillae are there, largest papillae, and they form the crypts. They form the crypts on their sides, and that crypt goes deep inside, and these are all the taste buds present on the side of the circumvallate papillae. Largest of the papillae. On the inside of it, you have some of von Ebner glands, which are known as serous glands. They secrete the serous watery secretion from here. Why? Because whatever you are eating, to gain the taste of that, you need that part to be moistened. So if the taste buds are over here, nearby the taste buds, you need to have some serous glandular secretion so that the taste function can be done. I'm saying function always. So when the food will come over here, it will get moistened by this, the taste bud will do their function. Circumvallate papillae. Von Ebner gland. These are known as VO and von Ebner, EBNER, von Ebner glands. Right? You can see at the CV. This is the same thing. C for the crypts, V is for the von Ebner glands, and these secrete the mucus. That is the whole taste buds on their side, more seen over this side. Right? Okay, identify this one, guys. Identify the histological feature over here. Lacteal pancreas liver lobule of the mucosa of the colon. What is this? A, B, C, D. Yeah. Answer. Lacteal pancreas liver lobule or your... What's the surprise I didn't get to you, Abhi? Surprise. Answer over here. Yeah, this whole picture over here, that is actually obviously our liver. You can see the liver lobules, also known as the hepatic lobules. Also known as the hepatic lobules. Okay. In the hepatic lobule, remember the central part is a central vein. Central part is a central vein. This has to be your CV. Circumvallate papillae, no, central vein. Okay. And on the borders, you have to have some portal triad structures. Portal triad has to have in the borders. Okay. All these are your hepatocytes intervening with the sinusoids. Fine. Blood is going in this direction. Bile is coming in this direction. This direction is for the bile and that direction is for the blood. So the hepatocytes, sinusoids in between, the exchange is getting place over here. The exchange is getting place in the perisinusoidal space of Disse, having the ito cells and the sinusoid, that is all Kupffer cells, all that. This is a liver slide. Okay, have a look at the same thing. Same thing, nothing new over there. That is the central vein. These are all the hepatocytes and the sinusoids. Okay. Okay, and with this one also, guys, identify the histological feature. Identify this, not very difficult. Identification. Liver done, guys. This one, identify this. Options, should I say striated duct, crypts of Labercune, circumvallate papillae, serous demilunes. Seriously? Yeah, serous demilunes. Okay. So it is a serous demilunes. What are serous demilunes? Nothing. You have the two types of acini basically, the mucous acini and the serous acini, mainly in our salivary glands. Okay. Few features are there. Serous acini actually stains more, though they look more darker. Mucous acini, they have appearance more of a lumen. Why? Because the cells are more of the, you can say, the pyramidal shaped over here, and they are less of villi over here. But serous, they take the stain more, so they look more dark over here compared to the mucous acini. Now in the mixed sort of gland, you have both. So it's a sort of artifact where you get a mucous acini, the paler one, and on top of that you get some like the cap of the serous acini sitting over the mucous acini. That is sort of artifact mainly found in the mixed gland, that is your submandibular. It is a submandibular salivary gland. Okay, remember, mucous acini, serous acini, which is more darker, this is a serous acini. Mucous acini appears more paler. So mixed gland. Serous secretion is watery, mucus is thick mucus secretion. Okay, one more over here, guys. Identify the aerode. Aerode means this part identify. Adrenal cortex and zona fasciculata, reticularis and adrenal medulla. All the four options are given over here. These two are a part of cortex only, fine. No big deal. Answer. Yeah, guys, that was serous demilumen. Very good. Most of you correctly, not all of you correctly answered it. Yeah. Medulla. Manish, actually, this is actually a revision class. So we are actually trying to, go all the slides. If you just message me, I'll share you a link where I've discussed in special classes only all the histological slides. So you have that also. Okay, you have that also. But in this session, you can't take everything in every session. So I hope you getting the point, right? So don't worry, Manish, if you want, just drop a message, you will get it. Yeah, over here. So obviously that is the adrenal medulla. Why? Cortex is outside. Cortex, this is the cortex. Three layers of cortex are glomerulosa, fasciculata, reticularis. This is the adrenal medulla part. Adrenal medulla part. Right? That is the adrenal medulla part. Okay? Fasciculata lying in fascicles. Reticulum is the net-shaped structure. Glomerulus are sort of cup-shaped structure. Cells are normally sort of same, though you all know they secrete the hormones. This is like a sympathetic post-ganglionic. It secretes the epinephrine and the norepinephrine. Okay, medulla part. Okay, same picture, guys, showing you the cortex of this whole. Actually, let me outline this from here to here. This whole is your cortex. This whole is the adrenal cortex, and over here you have the adrenal medulla. That was what pointed out in the question. And these are three layers. The glomerulus, that is the glomerulus over here. That is whole the fascicles, fasciculata, and this is a net-shaped reticular, and this is the medulla. Different strain over here. So there are all the neurons over there, right? Okay. Let us do a couple of embryology questions. Is that fine? I hope that is fine. Couple of embryology questions. Answer this. Okay. 32-year-old lady complains of weakness in her hands and heaviness in her eyelids at the end of each day. This line should tell you a few things, guys. Chest imaging shows an anterior mediastinal mass. The organ from which this mass is most likely originated shares its embryological origin with thyroid, superior parathyroid, inferior parathyroid, or the larynx. Good question. Answer. Manish, we Telegram group, the Unacademy Telegram groups only. In that also I posted. Else we have the just post over there in the Unacademy Telegram group. You'll get all the details. And if you want the links and all, you can notify over there. We'll share the link also over there. So don't worry. But answer this question first of all. Reaching out is not an issue. Focus on the present. Answer the question. Okay, we have answers. A, B, thyroid, inferior parathyroid. What is happening? Yeah. Weakness in her hands and heaviness in her eyelids at the end of each day, pointing out, I guess, towards myasthenia gravis. Yes or no? Thymoma. What do you say? Thymoma. Confirmed by the anterior mediastinal mass. It is a content of the anterior mediastinum. Now they're asking you, thymus, it's a thymus takes its origin or shares its embryology with whom? It shares its embryology with whom? With the third pharyngeal endodermal part, or you can say the pouch part, inferior parathyroid gland. Remember, I always tell the mnemonic, for the third you write THIRD. The third pouch gives rise to the thymus and the I for the inferior parathyroid gland. Look at the picture. Look at the picture. Where it is? Yeah. These is the first pouch, second, third and fourth pouches. Fifth pouch remnant is there. First give rise to the middle ear and the auditory tube. Second give rise to tonsil. That is your third. Thymus and I is for the inferior parathyroid gland. Fourth give rise to superior parathyroid gland, and its remnant will give rise to the ultimobranchial body. You know the parafollicular C cells of the thyroid gland. Okay, that was the question. Enjoyed the question? Try to understand. Clinical case. Identify the organ. Tell the embryology. Tell the embryology. These are all these are known as interrelated, integrated, whatever you want to call it as. One more question, guys. A male patient undergoes surgery for a sublingual mass. Okay, done. Over here. Image given below that seems to impair his breathing. So this is some mass, and for that the patient got a surgery and which was impairing his breathing. Fine. So therefore he got the surgery. Else what was the need? The infant is brought to the ER. ER is emergency. Several weeks after the surgery, with several weeks after. So the surgery was done. Now he is coming. History is important, guys. He is coming not next day, but several weeks with lethargy, feeding issues, and constipation and dry skin. Okay. Of the following, which embryological processes most likely failed in this patient? Oh my God. Identify. Answer this. Question is, this was removed after a few weeks. The child came with these issues. Tell us what was lacking embryologically in this child. Differentiation of something, apoptosis, migration, or fusion. What was happening? Answer, guys. Kaushik is going with apoptosis. B. What is B? Apoptosis. Okay, apoptosis. What is Zahedi is going with D. What is D? Fusion. What happened over here? What is this over here? What is this? Sublingual mass. From the tongue, you have the thyroglossal duct that forms the thyroid gland. So it has to migrate from the foramen cecum area of the tongue down and down and down and down over here in front of the neck, and from the thyroid gland. In this particular case, the thyroid gland was this, the ectopic thyroid gland. Around the tongue, also known as the lingual thyroid. It's also known as the lingual thyroid. It's an ectopic thyroid. And none of the thyroid went below. None of the thyroid, all of the thyroid remained here only. So it slowly formed a mass. That mass, obviously, tongue is an organ in itself. The tongue also developed. This mass also developed. Obviously, it will hamper in the air breathing issues. Now this was removed. but that was the only thyroid tissue in this particular child. So he had all the features of hypothyroidism. Lethargy, feeding issues, constipation, these are the signs of hypothyroidism. Okay, so what actually happened? The migration of the thyroglossal duct was hampered. This migratory path of thyroid gland, right? What is it written? Migratory path of the thyroid gland, that was actually hampered. And this is a different thing. This is different thing. So I can see some of you are actually confused with the thyroglossal cyst also. That's different. Cyst is different. It is not in the tongue. Cyst is on the way around the hyoid bone. It is normally around the hyoid. This is the common position of the cyst, mainly in the subhyoid. Subhyoid location is the common location for the thyroglossal cyst occurrence. Right? So this is a case of ectopic thyroid, lingual thyroid, the only tissue thyroid that was actually, sorry to say, it was removed by the surgeon and the child was left with no thyroid. Lifelong he has to take the hormones. Okay. These were a couple of questions on the embryology part. Don't worry. We'll come with more. So this was our session on the embryology and histology. Mainly we dealt with histology and some embryology also. There will be more. Okay, there will be more. So that's all, guys. So see you tomorrow morning also. Don't worry. Tomorrow morning we'll do the thorax. How does that sound? Wake up, have your breakfast, meet at 10:30 in the morning, and we'll have this. At 11 we'll have a special class. Okay, we'll have a special class, and we'll discuss the other features. Okay. So from tomorrow also, another thing, these are all the courses which are going to launch from tomorrow, 16th of June. So tomorrow is a big day for all these courses. One day they are starting, right? So all the best, guys. So think of it, think of these offers, and that's all. So I hope you like the session. Any issues, anything, reach out. Reaching out is very important. Ask your doubts, revise the stuff. And if you have any doubt, anything, we are all your seniors only. We'll try to help at the best way possible. Thank you for your time, guys. Bye-bye. Good night.